If there is any difficulty in releasing acetylcholine or acetylcholine making its way to the receptor, one will have difficulty coordinating and initiating muscle movement. The classic disease that's associated with defects with the acetylcholine metabolism is, of course, myasthenia gravis. This is a muscle disease characterized by immune-mediated destruction of the acetylcholine receptors, an effect on the postsynaptic part of the nerve-muscle junction. What this is characterized by clinically is a patient who comes to you and says that they have weakness of a muscle that is intensified by attempts to use the muscle, but that the muscle itself then recovers on rest. It's a rare disorder appearing in approximately only 3 out of every 100,000 people in the population. Think about this in younger women, those under the age of 40. And if one makes a diagnosis of myasthenia gravis, you also want to look at these patients for possible thymic disorders, such as thymic hyperplasia and possibly the presence of a thymoma. If they are examined on physical exam, they may show features such as diplopia, and they will see improvement in muscle strength when treated with anticholinesterase agents. Complications of untreated disease are death from respiratory failure. Here, what one attempts to do as the antibody is to the acetylcholine receptor is stop the effect of acetylcholinesterase. This leaves acetylcholine present for a greater period of time within the junction between the pre- and postsynaptic terminals and gives the acetylcholine more time to find unoccupied receptors and perform a physiologic responsibility. Another disease of the neuromuscular junction is Lambert-Eaton myasthenic syndrome. One will often see this as part of a paraneoplastic syndrome in patients, for example, who are affected by something such as small cell cancer of the lung. Here, the antibodies are not to the acetylcholine receptor in the postsynaptic area, but rather to the presynaptic calcium channels. These antibodies prevent acetylcholine itself from being released. These patients complain of proximal muscle weakness with symptoms that may be similar to myasthenia gravis. They're also prone to developing autonomic dysfunction, and treating them with acetylcholinesterase inhibitors, one will not see as great an effect as one would see in the treatment of myasthenia gravis, if any. Again, the problem here is that they have antibodies to the calcium channels that lead to the release of acetylcholine, and thus the acetylcholinesterase esterase inhibitors may not be able to increase the levels of acetylcholine, if there is any released, enough to relieve the symptoms of this disorder.